Hello everybody, myself Dr Prashant Mahawar. I am a pediatric cardiologist presently working at Narayana Multi-Specialty Hospital, Jaipur, Rajasthan, and I have been in this field for last 15 years. So today what I really want everybody to know is the basic concepts about the children with congenital heart disease. Because what actually is congenital heart disease? These are basically a structural heart disease, a defect in the structure of the heart, and it usually these babies are born with these kind of defects. So if you want to know what kind of these defects are, there are some different varieties of. For a layman, most of the people will talk about it as a hole in the heart, but usually it's not the case. Hole can be of different variety and it can be at different positions inside the heart. So our heart is a 4-chamber structure and it has valves, it has walls in between the chambers. So you can have defects which are affecting the partitions and the chambers, and they can have holes inside that which can lead to mixing of the blood. And at the same time you can have defect in the valves which ensure the blood in one direction. So these valves can be leaky or they can be narrowed, where we call them stenotic. So you can have narrowing of the valve as well as leaking of the valves, which can be there because of the defective structure. In addition to that, you can have what we call blue babies, because there you have a combination of defect which leads to mixing of pure blood with the impure blood. So that leads to blue baby syndrome. And nowadays, with advent of newer technologies and trained people, we can diagnose these kind of structural heart defects even before birth. And also with the trained eyes, we can detect many of them after birth with an echo. So their timely diagnosis and early intervention has led to a very good outcome in these children, and they can lead a normal life provided they are being picked up at right time and are being referred to the specialist at right time.